Have you ever ignored an itch thinking it was just dry skin or a random irritation? For most people, it's nothing. But for those over 60, that itch might be your body whispering something far more serious. Let's talk about the hidden signals your body may be sending you long before any doctor makes a diagnosis. Sign number 1. A persistent itch in the genital or anal area. This is one of the most overlooked yet crucial warning signs, often dismissed out of embarrassment. A persistent itch in the genital or anal region, especially when there's no clear cause like poor hygiene, infection, or skin irritation, can point to early-stage cancers such as vulvar, anal, or even penile cancer. It might seem like a reaction to toilet paper or a side effect of incontinence pads, but if it lingers for weeks or months despite creams, cleaning, or changes in behavior, it's a signal you shouldn't ignore. Take the story of Lewis, 76, who believed he had recurring hemorrhoids. He tried changing his diet, applying ointments, and even using compresses. Still, the discomfort persisted. Eventually, a scope exam revealed a small lesion, an early-stage tumor growing in silence. In women, postmenopausal itching near the vulva may indicate vulvar cancer. Even without visible lumps, the skin may become thinner, rougher, or subtly discolored. Some patients also experience small cuts or increased sensitivity in the area, mistaking it for irritation or dryness linked to hormonal changes. This area is rich in nerve endings and often reacts early to changes within the body. If the itch worsens at night or returns relentlessly to one spot, speak up. Silence is more dangerous than curiosity. Bringing it up to your doctor could mean early detection and peace of mind. Sign number 2. Itching around the chest or breast. Many older adults experience itching around the chest or breasts and chalk it up to tight clothing, age-related dryness, or even laundry detergent. But persistent, localized itching in this area, especially near the nipple or beneath the breast, can sometimes be the first indicator of inflammatory breast cancer or tumors near the chest wall. This kind of cancer can show up with no lump at all, just subtle changes like warmth, tightness, or an unshakable itch that doesn't respond to creams. Ruth, a 69-year-old woman, experienced this firsthand. She switched bras, detergents, even went without a bra, thinking it was a minor irritation. But that stubborn itch remained in the same spot. Her doctor eventually found a small but aggressive tumor close to the skin. This form of cancer spreads through the lymphatic system, and often inflammation in the breast tissue can cause early sensory symptoms like itching, tingling, or a strange crawling sensation beneath the skin. Men, too, are vulnerable. Male breast cancer, while rare, often goes undetected because the signs, such as a persistent itch or thickened patch near the nipple, don't match what most men expect. In some cases, it's not even the breast tissue itself, but nearby lymph nodes under the arm or near the collarbone that trigger the itch, signaling lymphoma. If the sensation is focused, long-lasting, and doesn't move, don't ignore it. Awareness, not machines, is often what leads to early discovery. Sign number 3, itchy scalp without flakes or rash. An itchy scalp is usually blamed on dry skin, shampoo, or aging. But for some, especially older adults, an itch that sticks around without any visible flakes or redness can be a hidden warning. Persistent scalp itching, particularly when it feels like tingling, burning, or crawling, has been linked to blood-related cancers such as leukemia and also to early-stage skin cancers where the hair is thinning. The key difference? It doesn't behave like a normal dry scalp. It moves from one spot to another, and no shampoo, oil, or moisturizer brings relief. Dave, a 73-year-old man, thought it was just his hair product or daily hat-wearing routine. He made all the changes he could, but the itching stayed. A routine blood test later revealed abnormal white blood cell levels. The final diagnosis? Early-stage leukemia. That was the only symptom his body gave him. In many patients, persistent scalp itching is also accompanied by changes in hair texture or sensitivity when brushing or combing, which may indicate underlying nerve involvement. And in other cases, skin cancer on the scalp may start as a dry patch or an itchy bump that never heals. Because the scalp is hard to examine alone, ask a trusted person or hairdresser to check if something feels off. Combine a persistent scalp itch with other signs like fatigue or unusual bruising, and you may be catching something important before it grows louder. Sign number 4. Itching between the shoulder blades or upper back. Most people don't give much thought to an itch on their upper back. It's easy to blame it on a clothing tag, dry air, or bad posture. But for some older adults, this very specific spot between the shoulder blades can be a red flag for pancreatic cancer. Though it seems unrelated, the link is real. When a tumor grows in the pancreas, it may block bile ducts, causing bile salts to leak into the bloodstream. These salts then circulate and irritate nerve clusters in the upper back, creating a deep, persistent itch with no visible rash. Linda, 70 years old, had exactly that. She tried changing her mattress, her detergent, even her skincare products, but the itch never went away. It wasn't painful, just constant. Blood tests later revealed elevated liver enzymes, and scans uncovered a tumor pressing against her bile duct. That strange itch turned out to be her body's only warning sign. In some cases, patients with this symptom also describe experiencing vague digestive discomfort, bloating, or a loss of appetite, which often appear only after weeks of subtle itching. So, if you're dealing with a deep, stubborn itch in the same spot, especially at night, and you've ruled out all surface causes, talk to your doctor. Pair it with other subtle signs like darker urine, pale stools, or fatigue, and don't ignore what your body is trying to say. Sign number 5. Itching on the lower legs, especially shins and calves. Itchy legs are common in older age, but when the skin looks totally normal, no rash, no new lotion, no visible irritation, and the itch refuses to go away, it may be more than dry skin. A deep burning itch on the lower legs has been linked to blood cancers like lymphoma, particularly Hodgkin's lymphoma. This isn't an itch that comes and goes. It lingers, gets worse at night, and doesn't respond to moisturizers. That's because the cause isn't on the surface. Lymphoma affects the immune and lymphatic systems. As cancer cells grow, they release inflammatory chemicals into the bloodstream that can irritate the nerves in the legs. Even if the skin looks fine, the body is reacting from within. Kevin, age 75, experienced this. For 6 months, he had an uncontrollable itch on the front of his legs. His doctor initially assumed it was eczema, but blood tests revealed abnormal white cell levels and scans showed swollen lymph nodes in his chest. His only symptom for months was the itch. Some lymphoma patients also report goosebumps or strange hot and cold sensations on their lower limbs before other symptoms appear. If you or someone you know is applying cream after cream with no relief and the itch persists night after night, ask your doctor about it, especially if it's paired with night sweats, unexplained fatigue, or weight loss. Your nerves may be reacting before a lump ever appears. Not every itch is a sign of cancer, but when an itch becomes stubborn, when it stays in one place, when nothing seems to fix it, it's time to stop guessing and start listening. Cancer rarely begins with pain. It begins with small, quiet signs. These itches are not just annoyances, they are clues. And your body is doing what it can to get your attention. If you're over 60, don't write off unusual sensations as just part of aging. Ask questions. Get checked. Mention the pattern. In many of the stories shared today, the itch came first, sometimes months ahead of any test or scan. Early detection doesn't always start with advanced machines or dramatic symptoms. Sometimes it starts with something as ordinary as an itch that won't go away. If this video helped you see things differently, please share it with someone you care about. It might help them recognize a sign that could change everything. Subscribe and turn on notifications so you don't miss the life-saving insights we're sharing every week. Awareness isn't about fear, it's about control. Till next time, take care of your body. Trust what it's telling you, and thank you for being part of this growing community.